Hi, my name is Debbie, and I'm a patient at Valley Medical Center. So I was supposed to be on the 5-year colonoscopy plan, and for whatever reasons, I delayed that, and I was a couple years late. So I decided, okay, I need to take care of myself and schedule a colonoscopy. So about the time I was going to do that, COVID hit. And I thought, okay, I don't want to go into the hospital and have any kind of test with COVID. And so I reached out to my primary care physician and talked to her, and she recommended doing the Cologuard, the home test that you mail in for results. So I did that, and the results came back positive.
My name is Joseph Roberts. I'm a gastroenterologist here at Valley, and I specialize in interventional gastroenterology. So I first met Debbie for a colonoscopy after she had a positive FIT test. Everything went well, but unfortunately we ended up finding a colon cancer in what we would call the ascending part of her colon, or the right side of the colon. I was able to characterize her colon cancer at the time with multiple pictures, obtain a sample to look at under the microscope to confirm what we were dealing with, and given the context, place what we call a tattoo near the colon cancer so that in the event of a surgery, my surgeons can tell exactly where it is.
After the procedure, he came in and, of course, told me what he had found, a malignant mass. And that was a tough one. To hear those words was very frightening. He then told me that he's already been in touch with the surgeon that he wanted to refer me to see. And again, he says, you know, let's just do what we need to do and we'll get through this. And I just really appreciated how he handled that. Just made me feel more at ease.
I'm Dr. Greta Bernier, and I am a colorectal surgeon at Valley Medical Center. I met Debbie in clinic after she just completed a colonoscopy with one of my colleagues, Dr. Roberts, that unfortunately identified a colon cancer.
When I met with her, she explained everything in detail, and I really didn't have any questions because she was so clear in her explanation, and told me exactly what was going to be done, and not to worry, that I would be well taken care of.
When we do operations for colon cancer, the overall goal is to make sure that we get the whole tumor out, that we have what we call negative margins, meaning that we got all of it, and then really important that we get all of the lymph nodes that go to that part of the colon. I do these operations robotically, which is a type of minimally invasive surgery, meaning small incisions in the abdominal wall. We do all the work on the inside and then take the piece of colon out at the end once we're all done with the resection and the reconnection. It's really great for patients because it helps them get back to being themselves sooner.
I can't say enough about Dr. Bernier and the care she gave me before, during the surgery, and after. And I've continued to see her every 6 months, and she's truly a blessing. And I tell her every time that she saved my life, and I truly feel that way. She's amazing.
One of the big advances in surgical care, in particular in colorectal surgery, is what we call an enhanced recovery pathway, which means getting patients back to their level of function as soon as possible. And we follow that here at Valley, and that means things like getting them moving around right away, minimizing tubes and lines and drains and things that make them feel less like themselves. And that was a component of our care for Debbie, as it is for all of our colorectal surgery patients. And that really helps people get back to that level of activity that they want to be at.
I try to live every day to its fullest and try to keep stress low, because I know that's not healthy. My husband and I do a lot of fun things. We love basketball and football. We do a lot of horseback riding and travel, and we just really try to enjoy life. We've got a whole new outlook on things because it was quite a shock, and there's no guarantee in life. So live it to the fullest. I've actually given a lot of advice to people about getting their colonoscopies and getting screened. A lot of people just put it off. I keep telling them it's not that bad, and it could save your life.
I think one of the strengths of Valley as it pertains to digestive health is really our focus on access and getting patients what they need. And when it comes to colon cancer, it's very important to screen everyone for colon cancer.
One of the things I really like about working at Valley is that we can bring a really elevated level of care to our community and keep people in their home area with people they know and not have to go somewhere else to give them the best level of care that we can. We have an exceptional robotics program that I'm very proud of with a Center of Excellence designation.
I just really can't say enough about this entire medical center. I mean, the people here are amazing. I mean, how they deal with this every day in their work life, and they're just so good, so kind. You know, because we're all very scared, very, very scared when you get news like that. And to have people care about you, sincerely care about you, helps a lot.